Hello everyone and welcome. We have 3 people in the room and numerous people online. But I'm going to get started and hopefully people will still join us. So I am Professor Andrea Rother. I'm head of the Environmental Health Division here at the University of Cape Town, and I'm also an honorary professor with the London School of Hygiene and Tropical Medicine. And as you can tell from my talk, I was on sabbatical last year for the whole year. And I was with the London School of Hygiene for 7 months in the Department of Public Health, Environment, Society in the Faculty of Public Health and Policy. And then I moved over to Basel, where I was with the Swiss Tropical and Public Health Institute. Welcome, everyone. It's nice to have a few more bodies. And I was with the Environmental Exposures and Health Unit. And this is not a presentation about my sabbatical and everything that I did. It's just one piece of it. So really this component of corporate capture and commercial determinants of health. And I also need to acknowledge that I had generous funding from the Oppenheimer Memorial Trust. I had an international fellowship, and living in Switzerland, I could not have done it without that, because the rent for 1 month was 50,000 rand. So, yes, I'm grateful for that. So I had 2 hosts. My first host was Professor Shari Kovacs at the London School of Hygiene and Tropical Medicine, and I will come back to her. And then my second host was Professor Martin Roosley, who works with the KIL. Both of them taught me new things. So I learned how to stand up paddleboard with Shari, and I learned how to snowshoe in the Swiss Alps. So sabbaticals are also about having fun. So in 2021, I gave a keynote address for the International Society for Environmental Epidemiology. And the question I was sort of asking was, why is there an impasse we have done a huge amount of pesticide research. There's a lot of research, a lot of evidence that they're causing health effects and environmental effects. And why are poisonings still continuing? What's the problem? What's the underlying issue? And really, one of the things that startled me was, so Silent Spring was written in 1962. They're celebrating the 60 years this year. And almost the same issues are in the book that was written by Zaller in 2021, Daily Poison. And so you really have to kind of say, why? Why is this happening? So in the keynote, I came up with these sort of 4 reasonings that I had thought were undermining research. And there were things like the pesticide use context in many African countries or low and middle income countries, the whole legislative or lack of legislative support for pesticide legislation. We have the right to know, which means we have access to information, pesticide labels, but we don't have the right to comprehend. That is, you know, if you look at a pesticide label today, do you know what the color codes mean or what the pictograms mean? And so whose responsibility is it? But then there was this aspect of corporate capture. And that's what I kind of was looking at is, you know, what is the issues behind corporate capture? And just to give you a brief introduction to the pesticide industry in South Africa, if you're not familiar with it. So we don't have any production plants. We don't actually produce pesticides here. We import everything. So we import the active ingredients, but we formulate in the country. So we still do have sort of chemical factories, as it were. South Africa is one of the largest and fastest growing pesticides market in Africa. So that means we are also formulating and then exporting to the rest of Africa. We have doubled our volumes that we export, but we're also a net importer of agrochemicals, which I think is quite important. We have a lot of pesticide companies here. So we have a lot of small companies, but then we have also big transnational companies like Bayer and Syngenta. And so when I talk about corporate capture, it's mostly coming from the transnational companies and the umbrella organizations like CropLife, rather than these small SMEs. So just to give you a quick background, you know, what is corporate capture? It's things like we have a very small group here that regulate pesticides. If you look at Europe or the US, they have anywhere from 280 to 300 people. We have 5 to 7, and as of last year, we probably had about 2. Many of them moved over to industry, so they get jobs with, CropLife or Syngenta or others because they're lucrative. The other problem we've had is you cannot in South Africa go online and find out which pesticides are registered here. It's being housed by CropLife at the moment. You have to pay them. And if you go on too often trying to find out what pesticides are registered in South Africa, they will throw you out and say that you're accessing it. So it's not transparent and there's no public accessibility. The industry shapes our regulations in South Africa. We will often have very strong policies and strong legislation, and they get weakened. I often think there's something going on behind the scenes, speculation. Also, you have things like, so when a pesticide is being registered, it has to be reviewed by toxicologists to see if the data is sound, but those toxicologists are coming from industry. They're being consultants by industry. And then lastly, things like we no longer have a good independent extension service. There's no funding for that. So that's a role that industry has taken on. And corporate capture is not an African problem. It's happening. There's lots of lobbying that goes on in the US. You just have to look when a presidential election is happening, who's paying for what. I'm not going to go too long into this, but the double standards is one of the things I highlighted in my presentation, and that is a lot of pesticides are banned in Europe. And you can see that even though they're banned for use in Europe, but they're not banned from production. So the companies can still produce them and export them, and you can see the kind of reach that they're having. And that is a problem. And a lot of them are what we call highly hazardous pesticides, which earn a lot of money for organizations and industry by exporting them to, for example, like South Africa. So now moving on, and this is where I'm going to move into now my sabbatical. So moving from corporate capture to commercial determinants health. So in 2013, Miller introduced the term corporate determinants of health. And that was, he was looking really both at both positive and negative influences. But the term corporate is much more referring to like an organization like Syngenta or CropLife. But when we talk about the commercial determinants or commercial, it's really the activities of the industry to make a profit. And it's those activities that impact negatively on health. So in 2022, I was at LSHDM and I went into the office of the head of the unit, Mark Pettigrew, and we were just chatting away. And he dropped the term commercial determinants of health, which I hadn't actually come across. And I thought it's a real problem that we, maybe many of you have, but I think it's a problem that many of our students and academics aren't thinking about commercial determinants of health. We think about social, we think about environmental, but we often don't think about the commercial. And they actually have a commercial determinants research group, which I then joined. And you can see some of the members who I am now working with. We meet regularly, and I'll come later to things that we're publishing together. And they're really looking at research on unhealthy commodities. So they're focusing more on things like alcohol, gambling, smoking, and food. And chemicals and pesticides was an area that they were not looking at so much. So that's the kind of contribution that I brought in. And you can join their Twitter account if you want. But really, it's looking also at misinformation strategies of harmful practices. And these are their topics. So things like what tactics do the corporate uses, the evaluation of the effects of the commercial activities, a lot of conflict of interest, application of methodologies. So I'll come back to this discourse analysis. So what is the actual discourse that's going on between industry and either science or scientists, but also the consumer? You know, in pesticides, they're always talking about it being safe, but you can also think about it with the alcohol and food. And they have very much a systems thinking approach. And I mentioned the areas that they focus on. So Nathan is one of the guys that I work with, and he was saying that commercial determinants of health really kind of broadly are those activities of private sector that affect the health of the population. And just, to remind of the difference between social determinants and commercial determinants. So you still have social determinants impacting on pesticide exposures and environmental determinants. So things like people's age or their employment or where they live or if their house is next to a factory. But the commercial determinants impacting on pesticides are more, I almost said sinister, but I can't say sinister. The kind of strategies and practices that they use to promote their products and sway people to use it. So things like all herbicides are safe, or we need things for food security, and I'll come back to that. I just pulled out this diagram. It's actually from oral health. Someone was looking at the impact of the commercial determinants of health on oral health and what is being said in dentistry. I haven't researched on this much. I've put the reference if you want to look at it. But I just found it, I liked the way they had the kind of social determinants in the middle and the commercial determinants outside. And I think this is something that I want to work more with our students and get them to think about that. If you're looking at the social determinants or environmental, what about thinking about then the outer, the commercial? So I started asking the question, what was the underlying cause? Why are pesticide poisoning is happening? What is undermining, or is our commercial determinants of health undermining our good epidemiological research? We really have a lot of research. And I felt that this was an under-researched area. So in last year, while I was on sabbatical, I went to the International Society for Environmental Epidemiology conference in Greece, and I decided to give a talk on the commercial determinants of health. And no one was talking about it, but it was fascinating because a lot of people came up to me afterwards, and I noticed that there were people working on it, just a few people, often older generation, interestingly enough. And I found that people who are doing epidemiological research or good qualitative or scientific research should actually be thinking about the commercial determinants. So there are a lot of frameworks for assessing. I'm not going to give a review. That would be a discussion on its own. But although it's a new field, the sort of impact of alcohol and tobacco and gambling is not new, is pretty old. And pharmaceuticals, opioids, all of that. So, but the frameworks are coming out, and what I found is interesting is that the WHO now recognizes commercial determinants of health, and they have a dedicated website, and they also have fact sheets on it. So looking just briefly at, when we talk about, well, what are the commercial determinants of health? What are the impact that the industry is having? And if you haven't read the book Merchants of Doubt or watched there's a really good documentary, I highly recommend you do. I make all my students watch, and several of them are online, so you will be watching it soon. So what do they do? So the original playbook was from tobacco, and you can really look at what tobacco did, and that is being repeated again and again. Climate change, pesticides, and it's this doubt and denial. Well, we don't really know whether it causes lung cancer, never mind the fact that they knew for 50 years that it was. Another one that's really interesting is the delay tactic. Now, I don't know if any of you participate in UN negotiations. Now, I participate in a lot of chemical UN negotiations, and the delay tactic is heavy by the industry. So it's all the time making things slow down. You just need to look at the climate change negotiations and why are they so slow. Undermining the evidence, so attacking scientists, saying that their research isn't good, or trying to influence the research by funding it, or actually having ghostwriters, owning the message, trying to actually say that alcohol is safe or tobacco is safe, and then shifting the blame and responsibility, which I'll come back to because that's used quite a lot with pesticides. So this is just a nice diagram to kind of show the 5 tactics that are used by industry to undermine the science. So they fake the science, they really manufacture uncertainty, they harass scientists. So I sit on a joint meeting for pesticide management, and the industry tried twice to get me off it by going to FAO and WHO legal. Luckily they didn't. But it's that kind of, really harassing scientists. I had 2 people come up at ISE, one who did work on glyphosate, who said they'd been so harassed, and then also spent a lot of time having to write letters responding to the industry. Again, a delay tactic. And then manipulating government officials, which is really a problem in South Africa here as well. I'm sure it is with many industries, but particularly with pesticides. There we go. Again, I won't go into this in huge detail, but what I started doing then was looking at, well, what are some of the key industry strategies for pesticides? So the social responsibility approach. Pesticides are safe as long as you wear your PPE, never mind the fact that you can't buy personal protective equipment, or it's too hot, or it's inappropriate, you're wearing the wrong gloves. Misinformation or lack of information, so the corporate capture, the lobbying. The lobbying is a bit more subtle here in South Africa, whereas it's a lot more open in the US. And if you watch some of these documentaries, you'll see the fierce lobbying that takes place. So the apportioning blame, the sort of apportioning responsibility, is very big in the pesticide world. So my students who are online will soon find out that I do not like the word misuse, because what happens is the blame for why poisonings happen is always blame it on the end user. Oh, it was the farmer. They misused the pesticide. They didn't use the right amount. They didn't wear PPE. And I'll come back to that in a minute as why it's actually not misuse. And then uncertainty science. And I'll come back to this in a minute, but it's also really important, I think, for us as academics to really guide our young students about taking corporate funding and the long-term implications. When I was at the ISCE conference, there was a student who quite happily, a PhD, was presenting that he had crop life funding, not realizing that that could taint his research findings for the rest of his career. So I think we need to also make sure that our students are aware of that. Nice thing about Sabbatical is you get time to read, perhaps not as much as I would like to, but I read then The Triumph of Doubt, which I highly recommend. And they really get into the detail of how the industry manipulated on. So the forever chemicals are things like Teflon pans, or if you get waterproof clothing, the way the science was manipulated. Climate change I mentioned, and it really gives a good analysis of how the industry is impacting on health and this whole science of deception. And so he does give a few examples of, well, what do you do? Okay, you've identified the commercial determinants of health. There's an impact by the industry. So these are just some of the tips, and I will come back to some other ones in a few moments. But, building independent evidence base that can be paid for but not controlled by industry. And I don't know if we have the mechanisms in place for that with, chemical companies. And so that goes to, tax the industry more, have more levies, have it go to government, and then government give funding to academics, for example. Use unconflicted scientists. So there are quite a few in South Africa who are working for the industry, but you will hear them talking on the radio or in newspapers as if, they are the expert on pesticides when they're actually being paid by industry. Recognizing the role of litigation, I don't think that works so well here in South Africa, but hopefully will improve. Effective organizations for investigating, so obviously the NGOs play a big role, and effective regulation, which again is an issue for us in many low and middle income countries. I wanted to come back to the discourse narrative, and I touched on it briefly. If you're engaging with industry, particularly when I engage with them in international arenas, it's listening to the messaging. So food security is used as an argument as to why we need to use pesticides. It's always saying if we're going to undermine food security, but there is no data and there has been no proof that pesticides lead to food security. Food security is usually an access issue. It's about access to the food markets. Often we're producing enough food, but people don't have access to it. The other one that's just coming up now, which is quite interesting, is there's a whole process about wanting to phase out highly hazardous pesticides. And these are a select small group of pesticides. that are too toxic to actually be used anymore. But the industry doesn't want the word phasing out. So they're pushing in the international arena that the words be used transitioning instead of phase out. Now think about that. Think about the implication between phase out and transitioning. And then the other one I mentioned then was about misuse and safe. So confidential business information has become another area where there's a bit of corporate capture, and that is that they're not required to disclose the co-formulates. So pesticides have an active ingredient, and then they have other ingredients that will make it a liquid or a powder or a granule. And those co-formulants, they don't have to put the information on the label because of confidential business information. It's their secret recipe. The problem is that sometimes those core formulants are more toxic. So in the case of glyphosate, there was a surfactant that was actually what was causing the health effects. But if you're a health professional and you're treating a patient, you look at the label, you will only see the active ingredient. And so you might not actually be treating the person accurately. So there's really a lack of transparency and lack of access to information. Well, I'm going to come back to this what I talked about, unpacking misuse. And if you want more information, you can have a look at the paper that I wrote a few years ago on unpacking misuse. You know, really, what are labels doing? Are they protecting people's health, or are they protecting the industry from liability, which is more likely the case? So to use the word misuse and to say that a person applying the pesticide is misusing it, you would have to have these 5 factors in place. So first of all, they'd have to have access to the label. So the label would have to be on the packaging, which it isn't always. It'd have to be in the language of the end user. So not in Chinese or Swahili, or, you know, it would have to be in whatever language they're in. Then the person would have to be able to read the label. So they'd have to have the adequate literacy levels, but then they'd also have to have more kind of scientific literacy, numeracy literacy, visual literacy. And then they'd have to have access to the facilities or the equipment. So if it says improve ventilation or, you know, wash your eyes out with copious amounts of water, which we never know quite how much copious is, they would have to have access to running water. So this is really unpacking, and in the paper I go more into what people have been using, what examples there are of what people refer to as misuse. So conflicts of interest, I mean, I think in this school we have covered this quite a lot, and this is an area that we do raise with our students, and I think it's important that we continue to make sure that we talk about conflicts of interest. And disclosing it when you give a presentation, disclosing it when you publish, for example. And there, if you watch any of the documentaries that I showed you, the one other book I read was the Monsanto papers, and they talk about the ghostwriting and how the science is being changed, and then it's being submitted by an academic at an institution, but was actually ghostwritten by Monsanto. You know, so there's a big conflict of interest there. It also taints the validity of researchers and the academic fraternity, and it, you know, ends up promoting the agenda of the industry. And I don't know if Leslie is on, but I'll never forget when I first started out here 26 years ago, and Leslie really drummed into me not taking any type of corporate funding, even for a flight to Johannesburg. And I really appreciated that, because it's a slippery slope if you start taking any money, any corporate money. And people do, and some of my fellow academics do take corporate funding, but they're open about it, and the data is not impacted. But you need to be very clear about that. And so I think it's a challenge for young researchers in Africa where getting access to funding is really hard. So we need to be, you know, clear about that. So another thing I started asking was, well, how can us as researchers incorporate the commercial determinants of health into our research? And really, it's, again, if if we're doing really good research, epidemiological research, or focusing on that, is broadening it out and saying, well, are there other factors that I could be raising in the publication? So the double standards, even mentioning the double standards. So doing research on 3 highly hazardous pesticides and then mentioning that these are actually being exported from, Europe into South Africa, so that it continues to highlight the issues, highlighting the legislative gaps, or highlighting the fact that we can't get into the database to find out what pesticides are registered in South Africa. And something that I've been moving more into, on the global arena, they talk a lot about indicators. So we're negotiating a new framework for chemicals management at the moment, and it's all about targets and indicators, and wanting these indicators to see whether, chemicals management, pesticide management is actually having an impact. And I think it's really important for young academics and us as more developed academics to use indicators in our journals, articles, and to say, how the data could be used that we've generated to feed into an indicator, and that this can be then used for monitoring. And I just sort of did a few examples of when you're looking at the commercial determinants of health, if you want to sort of look at the pesticide industry's influence on market strategies, well, what could you have as an indicator? Looking at per capita spending on advertising of pesticides, and then looking at the number of adverts in the country, or confidential business information and looking at the number of products that actually have co-formulas on it, or how many scientific papers are being funded with corporate funding, and so on. A couple of other things is, I'm going on a lot about young researchers because I think they're the ones that are quite vulnerable, particularly in Africa. And so they need guidance. This is something I'm hoping that one way or another will bring in commercial determinants of health into our teaching. I know my students will start hearing more about it. And to really kind of identify the issues and let them work through how to integrate it into more scientific research. And we need to, as I said, include it in the curriculum. So some examples of how to continue training. So my colleague I mentioned earlier, Nathan Mani, is doing a podcast. He's just started. There's been 3 episodes looking at money, power, health, and I recommend listening to them if you want to know more about it. LSHTM is actually running a course. They were doing an online short course on how to conduct research on the commercial determinants of health. So there's one is, conducting it, and the other is how to analyze it in relation to different frameworks. And who knows, maybe there's an opportunity for UCT. And there's a new Lancet commission coming out on commercial determinants of health. I tried to check to see if I could find the dates, but I was unable to find it. But so heads up, keep an eye out for that. And, visit the WHO website. So another question I asked is, what can we as researchers do to work with or challenge the industry? So everything I've kind of been presenting has been us analyzing, us highlighting. But how do we engage with industry? How do we actually work with the industry to perhaps move to a less toxic environment or impact of their products? And I'm not there yet. But I started by reading Nudge Theory, another book that I read. And I started it. It's fascinating. I'm sure many of you are familiar with nudge and sludge, which are interesting concepts. And this really focused on behavioral sciences and in the public policy arena, and how regulatory processes can change consumers' behavior. And interestingly enough, I didn't know this, but many governments have kind of like a nudge department. The US government has one. The UK government has one. I don't know if we have one. But basically, it works on nudging people to healthy decisions, healthy financing, healthy eating, healthy choices. you know, so for example, if you go to a shop and you're waiting in the queue to pay, you get lots of little nudges by all the things on the shelves. And some supermarkets have gone to more healthy stuff to nudge you to buy the healthy things, and others just have the chocolate bars and the chewing gum. So I've been trying to figure out, is there a way that we can nudge the industry to move into an arena where they're having less of a negative impact? I mean, obviously they are profit generating and they will have an impact, but is there something there? You'll have to watch this space. I'm still working on it. So now what I want to do, just the last bit of my presentation, is tell you one thing that I have been working on as well in Sabbatical, and is writing an academic textbook. And so it's called Environmental Health in Africa, From Concepts to Case Studies. And my co-editor is Shari Kovats from LSHTM. And you can see the different approach that we are taking to this. So we're looking at research in Africa, then we're looking at the different risks and health outcomes. And then we've got a section called Social Determinants of Health, which actually we have the commercial determinants of health. And I'm writing a chapter with my colleagues from LSHTM on it. And just to show you the chapter on the commercial determinants of health, it's really to give students an introduction to it. You know, what are the methods that are being used by corporates in Africa for different aspects of environmental factors, and looking at what are some of the conceptual frameworks for analyzing commercial determinants of health, what are some of the methods for researching it, conflicts of interest, again, the indicators, and then what are some of the mitigation strategies that are available. So the process of the book is going to be that each chapter is led by an African author from throughout Africa. And we are focusing sort of in the first instance on good research methods. So if you wanted to do something on air pollution or waste pollution, what would be good sound data that you would, methods that you would need for collecting the data? So that's the kind of in the first instance. But the reality of it is, so in my own case, having to, or conducting research here on, for example, herbicides, we were unable to collect urine samples and blood samples because we had a high HIV and AIDS population, and they didn't want to give blood samples. So we then used other methods. We used risk mapping, we used focus groups, we used a whole, what's it called, photo voice, where we gave them cameras and got them to photograph their exposures. So it's going to be giving options if you're a resource poor country, or for some reason you can't collect the data. What are some of the options for these environmental health risk factors? And then we're using African case studies, and as I mentioned, prevention and risk reduction measures that are not coming from high-income countries, but are more appropriate for low and middle-income countries. The UCT libraries, we've been engaging with them. They're going to publish it online, so the textbook will be open access and free, because textbooks are just too expensive for our students. And it should be available mid-2024. That's the plan. We're deep in working on it. And I think I've finished quite early, but I'd like to thank everyone who made it possible for me to have my first sabbatical in 25 years. That was the problem of being contract staff. But it was great. I'm ready for another one. So thank you. And questions. So I don't know if anyone wants to make any comments or questions. Yes.
Yeah, thank you so much, Andrea. I'm an obesity researcher.
Oh, right.
And so, that it was interesting to hear the term commercial determinants of health, because in a way that's what we deal with in a lot of our work, whether it's McDonald's or Pepsi or Coca-Cola, all of these massive industries that are driving the obesity epidemic, and portion sizes, and when you come out from policy, trying to institute soda taxes or other ways to reduce portion sizes, it's all there's commercial determinants of health. So I wanted to thank you for, I hadn't heard that term. I mean, we come at the same problem, but I guess from a different lingo. So certainly I can incorporate that into my curriculum and lectures. Yeah.
Great. Yeah, I mean, I hadn't really heard about it either. I mean, we were talking about corporate capture. That's what we kept talking about. And I don't know, have the rest of you have you been working on this issue?
No, but we have somebody doing a session in PHS this year, so that's
Excellent.
interesting. Yeah.
Okay.
I think it's something that we kind of knew about, but haven't necessarily given it a name and engaged with it. Very nice.
Yeah. And I mean, they're really, at LSHTM, they're really taking off with it. And not only them, but I mean, the fact that the WHO has a whole website of it, you know, I was also quite surprised. And now they're doing a Lancet commission on it, which will be interesting to see what's coming out. I see there's a whole lot of discussion going on in I think.
I don't think that's the chat. I think.
Oh, that's not the chat. That's me talking.
Going up.
Going up.
Yeah, and there it is. Okay. Leslie, are you still on? Did you want to come on and say something?
Well, I am on. Can you hear me?
Yes, loud and clear.
Yeah.
Go ahead.
So I had a shortlisting meeting, which was so short, I fell off my chair. It took 15 minutes so I could attend this. So I'm glad that you remember that story about the travel to Joburg, because I certainly wouldn't have. I just want to make one point which I put in the chat. So corporates by law have to make a profit. That's the nature of corporate law. So you can be as nice as you like or want to do a good thing for HIV or whatever. But at the end of the day, if you don't make a profit, you fail in corporate law. So there's a structural problem here. And I think we forget that sometimes. And we have many examples in South Africa where corporates are undermining different kinds of public health strategies. But it's a wicked problem. It's quite hard when there's a shortage of funding, as you say. I had put in the chat that we're going to be developing, well, we have developed a conflict of interest toolkit for ethics committees and science councils in Africa, and that will be available. But I mean, the participants in the workshop we ran basically say that if they're short of funds and some company comes along to offer funding, it's quite hard to refuse that. And we've published some work on that with the American University of Beirut as well. So I posted some resources in the chat for people if they're interested.
Great, thanks for that. Yeah, hopefully we can get access to that. I mean, one of the things so the International Society for Environmental Epidemiology, I think it was when it was all online with COVID, they actually made everyone who gave a presentation do their declaration at the beginning. But last year, when we were actually in person, they didn't. And I think that's a problem. You know, I think that we should, as a practice, always have to declare our conflict of interest. Now, how do I find whose hands up? Let's see. Marlies. Go ahead.
Good afternoon. My name is Marlies and I'm from the Health Justice Initiative. And thank you. I think you were responsible for getting the textbook into the UCT library. Lucia just mentioned that we're going to do a module in the MPH, and I was really keen on the book. And then lo and behold, it was already in the UCT library. And thank you also for the resources in your PowerPoint. So my interest is in pharmaceutical companies, and we work on the intersection of health justice and now more climate justice. And I think corporate or commercial determinants of health is a really useful entry point to see the behavior of pharmaceuticals and some of the main pollutants. And something that's come up for me in some of the thinking about this is that we speak a lot about the negative determinants of health in terms of corporate and commercial. And I'm wondering if you have some examples of positive determinants in terms of these industries. And when you were talking about nudging, I was wondering if the Discovery Vitality Program, which one can argue is a good or a positive contributor towards health, and there's commercial aspects to it, whether that would be a factor in terms of that, or whether that would be a nudge.
So, you know, I work mostly with chemicals and pesticides, and nice to meet you. And I'm glad someone actually finds the books that we asked for in the library. It's a great book on commercial determinants of health if you're looking for it. And you can actually download the PDF, so it's quite nice. I think in the chemical sector, it's quite hard to find positives, except, you know, you might say with malaria, people would talk about DDT. You know, I would beg to differ on that a bit. It's always then the weighing up of health, you know, one risk for another. I think outside of the pesticides and the chemicals, you do have other examples, and pharmaceuticals is probably a good one where you would get more positive. And it's true, and it's not something that I've been focusing on because it's relatively new for me, but there are positives. There's definitely, I think, some of the industry, but you have to be careful with the messaging of being a positive, and then it's not. I'm trying to think of the example. There was recently one, it evades me at the moment, but I think it was in the food industry where they were trying to have a positive message, but actually there was a negative undertone to it. I'm sorry, I can't remember the example. And then what was the other point that you made? Sorry, I got lost in the.
It was about the Discovery Vitality Program, more in terms of the analysis of that interesting nudge book that you mentioned.
Yeah, I would say that's very much a nudge. Very much a nudge that they're trying to, particularly in terms of health, trying to get people to change their behavior. And I have to laugh. I know some people who really go over the top with, you know, oh, I need my points and I must do this and I must shop there and I must take my card with me. And I sort of think, oh my gosh, you know, so I do think it's a good nudge. It's interesting if you read the book Sludge, and it also a new concept for me where, you know, when things take too long, when there's too much paperwork, when you know, too many forms to fill in for income tax return, that becomes sludge. Whereas in Sweden, you actually get on your cell phone, you get your tax return and you push one button saying, yes, no, you agree. Whereas in the US, they get 200 pages, you know, that people have to read through and fill it in, and that becomes sludge. So they're kind of together, the sludge and the nudge, that some industry puts some sludge in place. But I would like to sit in on your lecture and see what you have to say. Anyway, maybe we can chat sometime.
Yeah, no, I'll contact you. Thank you.
Great. Thanks, Marlies. Laurie, I'm glad you've raised your hand. Please go ahead, because I see you posted something. And I think you're also doing work on commercial determinants of health.
Yeah, I've been doing some work in the Department of Pediatrics and Child Health around industry sponsorship of academic conferences. So where commercial milk formula companies are obviously paying for stands, but not only sponsoring conferences, also running advertorials in medical journals, funding research, funding posts. And so there's a big push, not just in South Africa, but globally, to try and eliminate the conflicts of interest associated with the formula milk industry. And of course, that's, in a sense, the thin edge of the wedge when you're looking at ultra-processed foods and the impact that has on health and nutrition. Yeah, so I was very excited to see the work that Leslie's doing, and I'm hoping that perhaps we can talk more about it and look at the linkages, because there's an infant and young child feeding project, advocacy project, led by Chantal Witten, based at UWC, that is looking at challenging, in a sense, the industry playbook here in South Africa. And there's just been the launch of the Lancet breastfeeding series, which again is focusing on these commercial determinants of health in the infant and young child feeding arena, and the way in which industry is really exploiting the fears and insecurities and stresses that parents face in those first few months of life, where everything is very new and the infant itself is still settling into life outside the womb. And in a sense, what they've done is they've pathologized very normal, natural infant behaviors, such as wakefulness, crying, and use that as a hook for marketing and selling their products. So that's another very powerful set of materials to take a look at in another arena. The other thing I wanted to just flag was the role of consumers. You talked earlier in your presentation about the right to know. And one of the things I came across late last year is work that's been done in the US, which is kind of pushing towards, I suppose, something like a sunshine declaration. So pushing medical practitioners to declare who is offering them sponsorship and support. And part of the reason for that is because consumers in the US and other parts of the world are concerned that doctors aren't acting in their best interests, that their decisions may be swayed by pharmaceutical companies in particular. And in a sense, that pressure has been driven by consumers, and now the academy itself is reflecting on its own practices and the professional associations. So just recognizing consumers are potentially a very powerful ally when we're thinking about resisting the commercial determinants of health. They're not just consumers. Once they're awakened and concerned about an issue, they are also citizens.
Thanks, Laurie. I mean, you raised quite a few good points. Two things that I'd like to comment on. One is, maybe I'll start with the last one first. The consumers. I mean, if you look, so my area again is pesticides and chemicals, and if you look at consumers in relation to that, and the way we've been conditioned that having ants in the house, or even cockroaches, or even bed bugs, things that are really unpleasant, people will go for chemicals straight away. And there's a whole lot of messaging behind that. It's disease ridden, or stigma, or I've got an unclean home. And actually, having a trail of ants in the house when it's dry outside isn't really going to be so problematic. But the consumers often don't realize and know that some of these chemicals, are endocrine disruptors, or they cause respiratory effects. Like leaving the mosquito vaporizer things going on all night, thinking that you're protecting your children from mosquitoes, when actually the vaporizer is more likely to be causing problems. So it's also the consumer's demand for things and the messaging that they have received in terms of, that insects are bad and certain things are not good, is an important aspect of it. One thing I didn't talk about was advertising. And I mean, in the chemical world, advertising plays an important thing. And, Leslie's done a lot of work on alcohol and advertising. I mean, advertising is a big aspect linked to commercial determinants of health. Before I went on sabbatical, I bought a pair of wool socks at Cape Union Mart, and I wanted to have them for going over to cold climate, didn't think much about it, but I'm a label reader. So I read the label when I got home, and it said anti-insect anti-insect ability, or it had a funny word, and all my alarm bells went off. Nothing on the label. So with a consumer journalist, we managed to get to the end of it and find out what the product was. It wasn't actually nanoparticles, it was permethrin. And then I Googled, I shouldn't say that, I researched permethrin. In the US, if you put any insecticide in clothing, you have to have a warning label that says that don't wash with children's clothes, don't wash with underclothing, because then you get all these chemicals on it. Nothing in South Africa, And so it's such a kind of quagmire of, how do you navigate that with consumers? But the other point that you raised, and this is a question maybe for everyone here, is there an appetite for us to start a kind of commercial determinants of health research unit like they've done at LSHTM. Because I'm focusing on chemicals, Leslie's on alcohol, you're doing, obesity, Laurie's doing with children and milk. I mean, is there an appetite? Should we think about maybe having an informal group and seeing how we could then infiltrate that more into academic teaching? I mean, you've already starting at this here, but with, I mean, I say
Marlies is the one who's taking the lead. She was doing hearts. Sounds like she's keen.
was she doing hearts? Okay.
Yeah.
I'll find out. Yeah, so I guess if you're interested, maybe let's say send me an email.
Yeah.
Everyone, I think, has my email, or I can put it in the chat. I think that would be a good start. Are there any other comments or questions?
There's the heart.
Is there another heart? Trying to multitask here. There we go. Would you like to make a comment?
Me?
Yes, you've been shaking your head, which is a good sign.
I guess one of my thoughts that was briefly touched on was who do we convince to kind of help that, because just like Westland was talking about, corporate interests might be directly opposed to the greater sort of public health. So who is the first person I think we need to get onto research side to convince them to say, actually, like, there are things that we can do against the private sector for the greater good.
Yeah, and I think it kind of is with the point that I was making about, the nudge theory that I was looking at, is how can you nudge industry, even though they have to make profits? How can you nudge them to perhaps not produce highly hazardous pesticides in Britain and export them to South Africa? How can one kind of stop that? So yes, they're making a lot of money doing that, but it means that we are all exposed to highly hazardous pesticides that British citizens are not. So, but what can we do? Is there some sort of tax incentive, or, yeah, we need to look at the positive as well, because they're going to continue. Are there any other comments or thoughts? But thank you for you.
Thank you for the very interesting talk, very important topic, and also good to see that there will be maybe new areas of research in the department, environment, talk with students. And thank you.
Thanks, Sabbatical. Well, one of the things I think is important is, I'll come to you now, Leslie. One of the things that I think is important is, like the International Society for Environmental Epidemiology, that we try and have sessions on commercial determinants of health in future. And perhaps there are other conferences and societies as well that one could have these discussions in. Leslie, do you want to make a comment or question?
No, so I think, no, that's a great idea. So PASA, for example, should be having, Public Health Association of South Africa should be doing that. I just wanted to make a comment, two things. One is the UN is actually negotiating a treaty on the obligations, the human rights obligations of transnational corporations, which is quite astonishing. And they've actually gotten quite far. And surprisingly, South Africa is one of the co-sponsors with Ecuador and a few other countries. But in a way that's sort of at global level, and we know that global agreements get watered down to the lowest common denominator, but there might be some leverage in that if it ever comes to pass. The other thing I wanted to say is we had a student who did his thesis on corporate influence blocking legislation around advertising of alcohol. And he also did some work around whether that constitutes violation of rights of people to free speech. And then that led on to a discussion about whether corporates have the same rights as individuals. And there's actually quite a big debate about that in legal circles, about whether they can claim rights in the same way you and I can claim rights. But I think that's all part of this discussion on corporate determinants, because a corporation is by definition an organization, it's not a person. And so if you're asking for public health policies that restrict the ability of an organization to make as much money as it wants to, that's a sort of regulatory, human rights, moral, ethical question as well. Thanks.
Yeah, thanks, Lizzie. The interesting thing is that there are so many avenues to this, the commercial determinants of health. You know, there's so many areas that you could focus on, first of all, in terms of the topics, you know, whether it's pharmaceutical or food or whatever, but it's also the different entry points. You know, is it the narrative? Is it the conflict of interest? So I really think it's important to start bringing in awareness about it and seeing how academics can start putting components within to their work. So it's not like you're just becoming a dedicated commercial determinants of health researcher, but you know, if you are an academic and you're bringing it in, I think is really important. And perhaps it's the societies we need to do and start here. And the younger generation, I'm really, maybe as I'm getting older, I really think the younger generation are so important to really bring them in and to prepare them for their challenges as well. Very interdisciplinary, absolutely. Yeah, it really is. Okay, so we have 3 minutes left. Are there any? I'm glad we had a bit of time for discussion. And so I did many other things in my sabbatical, but this was one that really opened my eyes, and having the opportunity to think about it. As I said, you know, I went over with my corporate capture hat and then came back with my commercial determinants of health. And it's very, you know, new for me, new thinking. Okay, great.
Thank you so much.
Thanks, everyone.
Amazing.